today is Sophia Mortenson, presenting her thesis titled Functional versus Conventional Medicine, Approaches and Effects.
Good afternoon. There are many different approaches to healthcare, but broadly, the two main categories are conventional medicine and functional medicine. Anything that is not considered a part of mainstream conventional healthcare practice is lumped under the umbrella term alternative medicine. One of these alternative approaches to healthcare is functional medicine. Functional medicine, often referred to as natural or holistic medicine, is based on natural remedies like lifestyle changes, herbal medicine, scientific research, and technology, and it looks at the patient in their entirety instead of isolating one issue or organ system. Conventional medicine is often referred to as modern, Western, or evidence-based medicine, based on pharmaceuticals, technology, isolation of the organ system or issue, and research. Conventional medicine is a surprisingly new approach and is estimated to have developed from the 19th century to the 1950s. Functional medicine is an older form of medicine that uses a more natural approach but also utilizes the technology and knowledge of modern medicine. Many Americans have been swayed into one of two polarized opinions, either a total distrust of modern medicine or a total rejection of such alternative approaches as functional medicine. Americans are under the impression that conventional medicine is best, most effective approach. A common middle ground perspective is needed in order to derive the best out of both healthcare approaches. Americans should change their approach to health from a solely one-size-fits-all conventional pharmaceutical approach to a personalized and natural approach that focuses primarily on lifestyle with selective conventional and functional interventions. Conventional medicine alone is ill-suited to effectively treat and cure many illnesses. Functional medicine more effectively treats the root causes of diseases like PCOS, endometriosis, hormone imbalances, obesity, and various autoimmune disorders without unnecessary side effects. It focuses on restoring the patient to optimal health, whereas conventional medicine often merely manages symptoms. Conventional medicine alone is ill-suited to effectively treat many diseases, as it treats the symptoms and not the issue itself, often causing many side effects that harm the patient and lessen their overall quality of life. One example of this is birth control, which is prescribed to women for many things such as PCOS, endometriosis, acne, migraines, and unbalanced hormone levels. 65% of women in America are prescribed birth control for these issues. It is overprescribed and distributed without a full explanation of its side effects or an explanation of other options. Birth control often causes or worsens mood disorders such as anxiety and depression, causes irregular heavy bleeding, acne, weight gain, headaches, nausea, cramps, and pain. A study done by UCLA shows that women on the pill have a more negative psychological response to stress. It can cause chronic inflammation, which can lead to diseases such as cancer, cardiovascular disease, autoimmune disorders, and mood disorders such as depression. The root cause of acne, PCOS, endometriosis, and other hormonal issues are often unbalanced hormones and vitamin and mineral deficiencies. This does not address the root cause. Something is wrong inside the body, causing the hormones to become unbalanced. Fixing hormone imbalances with synthetic hormones or stopping normal bodily function is merely putting a band-aid over this issue. Functional medicine has a different approach to treating hormonal issues that many women face. It looks at the whole patient, her lifestyle, her symptoms, to get a full picture and to identify the root cause of the issue. This is a vital aspect of functional medicine that conventional medicine often ignores. Although the medical world often claims that hormonal issues are normal for women and that painful menstruation, acne, endometriosis, and PCOS are common, this is not true. While these issues are common, they are not and should not be classified as normal. Optimal function is a term often used in functional medicine to describe the standard to which the health of the patient is compared. Conventional medicine compares the health of the patient with the current norm. The patient's health should be compared to the health and blood test levels of a patient at optimal or prime health. Functional medicine approaches the treatment of hormone imbalances differently. It is treated by looking at the patient's blood work, determining what hormones are lacking and which are in overabundance, and then working to heal the root issue through lifestyle changes. A change in diet, management of stress levels, and adrenal support will support and balance the hormones to prevent further hormonal issues. The lifestyle changes that will aid in the prevention and management of those issues have no negative side effects and protect against other health issues that could arise. Another example of conventional medicine being ill-suited for the treatment of many diseases and causing many side effects is obesity. Unfortunately, people are not taught how to care for their health properly, and often the conventional medicine world feeds into this by prescribing medication for diseases and issues that are completely preventable. The side effects of many weight loss prescriptions are gastrointestinal issues such as nausea, vomiting, diarrhea, constipation, cramps, and acid reflux, along with things like headaches, dizziness, dry mouth, and insomnia. These side effects can lead to hypothyroidism, glaucoma, coronary heart disease, and gastrointestinal issues. Doctors will also recommend natural weight loss through diet and exercise. The patient is told to lose a specific amount of weight in a specific period of time. If that does not work, then a pill will likely be prescribed. This method is unhealthy because it is not usually a long-term fix. Furthermore, just because the patient loses weight does not mean that they're healthy, and the side effects from the medication are often harmful to the patient's health. Functional medicine approaches to obesity is multifaceted. It is a treatment of the patient as a whole instead of isolating one issue. Mental health, history of weight loss or gain, history of issues of food, and lifestyle choices are taken into account when formulating the treatment plan. For the actual problem of excess weight to be solved, doctors address all of the factors that play a role and create an attainable treatment plan for the results to be long-lasting and beneficial. Solving the root problem resolves a cascade of issues, ultimately improving the patient's overall health and quality of life. Lifestyle choices are often the biggest factor in obesity. These include high stress and anxiety, an unhealthy relationship with food, lack of exercise, and unhealthy habits like smoking and drinking. The obesity rate in children and adults is only increasing year by year, and most of the major food companies make food filled with chemicals, sugars, highly processed foods, fillers, dyes, and preservatives that only worsen the obesity epidemic. Through a diet change like an elimination diet, stress management, sleep, daily exercise, weight loss can be achieved and be long-lasting. A third example of how conventional medicine is ill-equipped for the treatment of many diseases is in its treatment approach to autoimmune diseases. Autoimmune diseases cause inflammation, fatigue, joint pain, swelling, recurring fever, swollen glands, abdominal pain, digestive issues, and skin problems. Some of the more common autoimmune disorders are Hashimoto's disease, rheumatoid arthritis, type 1 diabetes, celiac disease, and other food intolerances. The treatment option for autoimmune disorders are immunosuppressants, pain relievers, anti-inflammatory medications, and IVIG infusions. The side effects of those immunosuppressant medications include a high risk of viral and bacterial infections, which can worsen the autoimmune disease. The body's ability to fight cancer cells is diminished, which can cause issues within the gut and the microbiome, leading to leaky gut. Autoimmune medications can also cause depression and anxiety, cardiovascular issues, and weight gain. Although autoimmune diseases are complicated, that does not mean that there is not a better way to treat the disease than by merely covering up the symptoms or reducing the body's natural ability to fight off invading diseases. Functional medicine takes a different approach to autoimmune disease treatment. The functional treatment approach works to prevent the disease, manage it, and prevent further damage or progression. Functional medicine assesses the body for infections, tests the adrenal stress profile for cortisol and DHEA levels, test specific antibodies, sleep quality, and metabolic health. Depending on those levels, the doctor can assess the patient for autoimmune or other diseases. A Mediterranean diet and increased physical activity can often reduce inflammation, pain, and improve physical function in patients with rheumatoid arthritis. Functional medicine focuses on restoring the body's immune system through an elimination diet, detox, supplementation of lacking vitamins, minerals, probiotics, and prebiotics. Autoimmune diseases need to be assessed and treated with a highly personalized approach and focus on lifestyle changes. While curing autoimmune diseases is very difficult, management of the disease through lifestyle and supplementation is enough to majorly decrease symptoms, improve quality of life, and prevent any further damage caused by the disease. People who care about their health and quality of life for themselves and the next generation should care about this issue. Health is an ever-present issue, and we should do our best to ensure that we are caring for our own and for others' health. The health of Americans is quickly declining, and people need to be informed of the issues with the current medical approaches. Americans should seriously consider the health of this country and the cause of its decline. More people need to read their own opinions instead of adopting opinions and beliefs without independent reason, and take action upon those. People should learn and understand health, decide for themselves what works best for them and their family, and be purposeful in every decision they make, because no matter how small it may seem, it will make a large difference in you and your family's overall health. Thank you.